Rosuvastatin side effects coming up.
Sunki.
Hi everybody, it's your pharmacist Sunki here. Today we are going to be talking about rosuvastatin. Make sure you stay until the very end so you don't miss out on any important information. Everything I say today is of general nature only. It does not replace the need to see your local healthcare provider. Let me know down in the comments below what other topics you would like me to cover. If you haven't already subscribed to my channel, hit the subscribe button now and thumbs up. Without further ado, let's rock it. What is rosuvastatin? Rosuvastatin belongs to a group of medicines called the HMG-CoA reductase inhibitors, also known as statins. It is most commonly known by its brand name Crestor. What is it used for? Rosuvastatin is used to reduce the cholesterol in our body. Cholesterol is taken into the body through food and also made by the liver. It is needed for our body to make hormones, bile, and vitamin D. There are two major forms of cholesterol: LDL, low-density lipoprotein, also known as bad cholesterol, and HDL, high-density lipoproteins, also known as good cholesterol. Too much bad cholesterol can block our blood vessels and lead to heart attack or stroke. On the other hand, good cholesterol removes the bad cholesterol from the body. Rosuvastatin works by reducing the amount of bad cholesterol made by the liver and raise the good cholesterol to reduce the risk of us getting a heart attack or a stroke. Now, before you start rosuvastatin, you need to tell the doctor the following. If you're allergic to any statins that was previously prescribed to you, and if you're allergic to any ingredients that is listed on the leaflet of rosuvastatin. Now, there are many brands of rosuvastatin, so if you're allergic on one of the ingredient, ask your pharmacist to try and find you another brand that does not contain that ingredient. Now, you need to let your doctor know if you have any liver or kidney diseases or breathing problems. If you are pregnant, intend to be pregnant, or likely to be pregnant, as rosuvastatin may affect the baby in your tummy. Now, if you're a woman of childbearing age and you are sexually active, your doctor might prescribe you a birth control pill to go with the rosuvastatin. Now, you have to let your doctor know if you're breastfeeding or intend to breastfeed. Rosuvastatin can cross breast milk and affect the baby. Tell your doctor as well if you have pain, tenderness, or weaknesses of the muscle from other medicines used to treat high cholesterol and triglycerides. Any personal or family history of muscles disorder, or have any unexplained aches and pains in your muscles. Any low thyroid hormone levels, hypothyroidism. If you're drinking alcohol regularly, as that will increase the risk of you getting side effects if you're of any Asian descendant. I know the doctor should clearly see that you are Asian, but if you're a mixed child, it's harder for some doctor to pick it up, and the dosages of Asian background and a Caucasian is different. Rosuvastatin can interact with many other medications. So make sure your doctor and pharmacist know all the medications you are taking. This includes all the herbal supplements, multivitamins, and minerals that you buy without a prescription from the pharmacy or in a supermarket. Now, if you're concerned that your doctor or pharmacist might miss any interaction, remind them to double check. Now, you can always bring a list of medications to your pharmacist, and your pharmacist will be able to help you work out if there's any interactions on the medication and let you know the severity of it and let you know what to do next. When your medication list exceeds a certain amount and it's hard for your doctor to keep track on all the interactions and side effects, your doctor will request for a specialist pharmacist to review all your medication and optimize the usage of your medication. If your doctor did not initiate that, you can always request your doctor to do so. What strength does rosuvastatin comes in? 10, 20, and 40 milligram. How to take it? Depending on your condition and ethnic background, your doctor will decide the most appropriate starting dose for you. The doses of rosuvastatin are between 10 to 40 milligram taken once a day at the same time every day to get its best effect. It doesn't matter if you take it with or without food. Now, if you forget to take it as soon as you remember, as long as it is more than 6 hours before your next dose is due. Otherwise, wait until your next dose is due and take it as normal. Do not double the dose to make up for the missed dose. If you have trouble remembering to take it, set an alarm clock on your phone so it rings at the same time every day to remind you to take it. Another technique is doing association reminder. Put a medication at the same spot where it's dry and at room temperature, say next to your breakfast bowl. So when you grab your breakfast first thing in the morning, you will see the medication and that will remind you to take it. Things to be aware of. Be careful driving or operating machineries until you know how this medication affects you. Rosuvastatin generally does not cause any problems with your ability to drive or operate machineries. However, it may cause dizziness in some people, so make sure you know how the medication affects you before you start driving or operate machineries. Tell any other doctors, dentists, and pharmacists who are treating you that you are taking this medicine. Tell your doctor that you are taking this medicine if you plan to have any vaccinations or immunizations, especially a doctor that hasn't treated you before. If you are going to have surgery, tell your surgeon or anesthetist that you are taking this medicine. It may affect other medicines used during surgery. Side effects. All medicines, even herbal supplements, vitamins and minerals, things you can buy without a script in your pharmacy, health food store or supermarket, can have side effects. Sometimes they're serious, most of the time they're not. You may need medical attention if you get some of the side effects. Now tell your doctor or pharmacist if you notice any of the following and they worry you. Headache, constipation, dizziness, nausea, feeling sick, stomach pain, unusual tiredness, itchy skin, memory loss, stiff or painful joints. These side effects are usually mild and short-lived. Now tell your doctor as soon as possible if you notice the following side effects. If you notice a significant increase in your need to urinate, or if you are significantly more hungry or thirsty than usual. There is a slight increase of risk of getting type 2 diabetes, and these are the symptoms of type 2 diabetes. Tell your doctor immediately or go to the emergency at your nearest hospital if you notice any of the following symptoms. Aching muscles, muscle tenderness or weakness not caused by exercise, particularly if you also have fever or generally feel unwell. There's a condition called rhabdomyolysis where breakdown of your muscle occur. This can lead to kidney failure and death. And these are the symptoms of rhabdomyolysis. Difficulty breathing, swelling of the face, eyelids, and lips. If you have difficulty breathing and coughing, particularly if you also feel generally unwell. If you feel fatigue, weight loss, or fever. Now these are very serious side effects. If you notice any of these side effects, send yourself to the accident and emergency department of your closest hospital. So those are the list of side effects that you have to be aware of. Now, those are not the full side effect list. If you feel generally unwell, just let the doctor know. More side effects information can be found on the leaflet of the medication. I will also put a link down below for you so you have access to them. Now, even then, the list of side effects there are not complete. New side effects can pop up. So if you experience any side effects that is not listed there, you can always report it to your country's medicine regulatory agency. In the US, it's called FDA MedWatch. In UK, it's called Yellow Card. And in Australia, it's TGA. I know I've listed many side effects and I don't want this to scare you because most people don't experience any side effects, and if they do, they are the mild side effects and they're usually short-lived. Many of my patients are on this medication for a long time and they're totally fine. And it's this medication that is keeping them alive. I want to remind you this is a life-saving medication. So if you are prescribed rosuvastatin, which means the doctor has determined that the benefits of taking this medication outweighs the risk of not taking this medication. So follow the instructions of your doctor carefully, take it every day, and if you do develop any of the side effects that we talk about, let your doctor know, and if they are the serious side effects, send yourself to the hospital immediately. Now, last note. It is great that we live in a world where we have all these life-saving medications in our fingertips. However, it is not a good thing for us to solely rely on these medications and not do any lifestyle modifications. This medication only controls the condition but does not cure the condition. things you need to do besides following the doctor's instruction carefully to take your medication daily on time is to exercise, control your diet, reduce fat and salt intake, quit smoking if you are smoking. Now, these are very important to keep your body strong and healthy. Now, work with your local doctor and your pharmacist to achieve that. Now, I have also made a smoking cessation video. I'll put the link down below for you. In this channel, I've also made other medication and health-related videos to help keep your body strong and healthy. It is a growing library of medication and health information. Besides a pharmacist, I'm also a singer-songwriter, music producer, and an actress. If you're interested in knowing my other life, check me out on my other videos in my other playlist. Now, if you haven't already subscribed to my channel, hit the subscribe button now and thumbs up and follow me on Facebook and Instagram. My handle is @SoonKiOfficial. It's your pharmacist Soonki here with lots of love. See you around.